Hello everyone. I am Dr. Abhinav Gupta, Managing Director of Makino International Healthcare Private Limited. We have chain of physiotherapy and rehabilitation centers in different hospitals and clinics. Today we are going to discuss about ankylosing spondylitis. Ankylosing spondylitis is a type of arthritis that affects your spine. It can cause pain, stiffness and inflammation from your neck to the lower back. When you have this condition, the vertebrae in your spine fuse together. This makes your spine less flexible and might lead to the hunched over posture and trouble breathing. Now, early diagnosis and treatment can control this condition and even prevent other problems associated with it. Coming up to the cause and risk factors, first and foremost cause is age. It occurs before the 30s of a young individual. Coming up to the prevalence according to the gender, men are 2 to 3 times more likely to get affected by this disease as compared to the women. Now if we talk about the genetics, you can inherit it from your parents. But one gene called HLA-B27 is common in patients with ankylosing spondylitis. If we talk about the ethnicity, ankylosing spondylitis appears more often among native tribes in the United States and basically in the Canada. Now coming up to what are the common types of ankylosing spondylitis? It comprises of 2 types, axial ankylosing spondylitis and the peripheral AS. In axial, it causes lower back ache, and in peripheral AS, it causes pain and swelling in the joints, but it will be other than the spine. Now, if we talk about the symptoms of ankylosing spondylitis, what are the common symptoms? Pain and the stiffness. You may have constant pain or stiffness in your lower back and hips. That will continue for more than 3 months. Ankylosing spondylitis often starts around the sacroiliac joints, where the sacrum, the lowermost part of the spine, joins the ilium bone and the lower back region. It might hurt more at night and gets better when the patient wakes up. You might also find pain in other joints such as your knees, shoulders and the jaws. Other symptoms will include bony fusion, that is basically ankylosing spondylitis. Litis is the inflammation, and in the later stages it will cause losses. Losses is fusion of the vertebrae. Then there will be pain in ligaments and the tendons. Spondylitis may affect some of the ligaments and tendons which are attached to the bones. Tendinitis is again itis. What is that? That is the inflammation of the tendon which is causing pain and stiffness in the area behind or beneath the heel, such as Achilles tendinitis we can say. Now another symptom is bent posture. Then breathing problems are there in patients with AS. Change of posture can lead to changes in your lung that makes it hard to breathe. There will be heart troubles because of the inflammation to the heart muscles. Eye problems are basically because of uveitis, a condition that causes inflammation in your eyes. And symptom will be the patient will be having blurred vision, light sensitivity and basically weakness in the eye muscles. Then inflammatory bowel disease will be there. The inflammation can also affect the digestive system, which will notify or which will be seen as a patient with complaints of diarrhea, belly pain and cramps. Bloody poops can be there, and loss of appetite and weight loss are the common symptoms. Other symptoms and less common symptoms includes psoriasis, rapid fatigue of the patient because of lack of sleep due to pain and irritability. Then dactylitis. What is dactylitis? The fingers and the toes, the distal fingers and the toes will be swollen. Then last one is what we can consider is fever. Over many years, if we talk about ankylosing spondylitis can also cause new bone to grow in your spine, basically fusing the vertebrae and making it harder to move. This can cause severe stiffness. About half of the people who have ankylosing spondylitis are osteoporotic or have brittle bones. Now coming up to the diagnosis and the test. Basically, what will be the common symptoms? We will find the inflammation at the back, muscles of the back will be affected. Then ongoing back pain from 20s to 30s of the patient. Then back pain which will last for more than 3 months. Other clinical symptoms what we will find is pain will get worse after the rest. Once patient will start moving, the pain will start disappearing. Pain that get better with exercise, with normal routine movements in the morning is also indicative of ankylosing spondylitis. Pain and stiffness that responds very well to the anti-inflammatory drugs like acetaminophen or ibuprofen can be used. A physical examination can show signs of inflammation in the joints or limited back range of motions. Look for the medical history, or it is very important to look for the hierarchy, whether the parents or the grandparents must be having this condition or not. Now coming up to the radiological imaging. First we'll go for a X-ray. Remember, early or when you suspect ankylosing spondylitis, immediately go for an X-ray, but there may have no symptoms of the disease on the X-ray because it shows symptoms after several years. But if we talk about an MRI will be taken for focusing on the SI joint where your spine connects to the pelvis, may show swelling or the inflammation in the early stages of the disease. If we talk about other radiological features, then we can go for CT scan, which will show the advanced stage of X-ray, and that will be also used to diagnose the disease just before the X-ray will show. Then we can go for blood tests like testing for HLA-B27 gene or the signs of inflammation. Now, what are the common treatments? If we talk about the treatments, then again there is 3 lines of treatment available for ankylosing spondylitis. First is medical treatment, surgical treatment, and the physiotherapy and rehabilitation treatment. Many medications are used as ankylosing spondylitis treatments, but newer ones may stop inflammation before it start to damage your joints or organs, like eyes are affected, uveitis I have told you. Now, what are the common medications that can be used? Non-anti-inflammatory drugs, NSAIDs like ibuprofen, indomethacin, or corticosteroids can be used. DMARDs can be used. DMARDs are disease-modifying anti-rheumatic drugs. Then biological DMARDs can be used. For example, Humira. Surgery can help in a curved spine, but it is not that much recommended till the patient can be treated conservatively. Surgery can also be done for hip and knee joints. Alternate treatments are the techniques can help ease pain and stiffness in addition to your other treatments. Which are these techniques? These are acupuncture, massage, or yoga. These kind of techniques can be incorporated, but relevant articles or the researches are not present till now. If we talk about the physiotherapy and rehabilitation part, multiple electrotherapy modalities can be used for the symptomatic management to relieve pain, like TENS, ultrasound, cold pack, cryotherapy, laser, IFT, depending on the symptomatic management and requirement of the patient. Other important consideration in physiotherapy and rehabilitation are daily exercises, which will help to keep the patient flexible. It will help to ease the low back pain and stiffness. Work out in a Warm pool is also very suggestive for these kind of patients. Appropriate posture correction, continuous movement after every interval of time, pacing between the exercises to avoid getting fatigue, hot and cold therapy, hot water shower, that is in warm water, or healthy lifestyle and food choices are the very important components of treatment for ankylosing spondylitis. Then if the patient is very bulky, the patient should be suggested to decrease some weight, as extra pound stress your back and other joints as well. Smoking can lead to worsening of your symptoms. When a patient is unable to leave this habit of smoking, the treatment is also not that effective. So first and foremost thing is, we have to reduce the symptoms or the things which are exaggerating the symptoms. Now if we talk about the prognosis of the disease, prognosis for ankylosing spondylitis. Ankylosing spondylitis should not affect how long your life is. See, you may have mild low backache that comes and goes, but if your disease is more severe, or the spine is getting curved, or you are having continuous stiffness, or having any fusion in the spine over a long interval of time, your rib cage could become fused, making it hard to breathe, then you have to go for a surgical treatment if it is not getting treated conservatively. Prognosis is good, but patient have to incorporate good lifestyle changes, follow their regular treatment plan, regular exercise plan should be there, and continuous follow up with the medicine, doctors of medicine, orthopedician, rheumatologist, physiotherapist and the surgeon should be there, as treating ankylosing spondylitis is a multi-team approach and it is not confined to a particular team, whether it is rehabilitation team or the team of doctors who are practicing medicine. If you have any query regarding the topic, or if you want to suggest some other topic us to make videos, you can comment us on healthcaremakino@gmail.com, or you can share and subscribe our channel on YouTube, that is Makino Care. Thank you.